Hello, I'm Professor McGrath. Today I'm going to demonstrate how to perform a complete set of vital signs on our patient here at Georgia Southern University's Nursing School Sim Lab at the Armstrong campus. I'll be showing you how to correctly perform hand hygiene, identify your patient using two identifiers, obtain an oral temperature, a radial pulse, respirations, and a manual blood pressure. I'll also demonstrate how to document these findings accurately. Let's go meet our patient. Before interacting with my patient, I perform hand hygiene. Hello, I'm Professor McGrath. Today I'm going to take a set of vital signs on you. Can I please have you state your full name and date of birth? Thank you. I verify two patient identifiers. The name Luis Navarrete and the date of birth on the band match what the patient stated. Next, I'm going to take your temperature. I'll place the thermometer probe under your tongue, so please keep your mouth closed around the probe until you hear it beep. For an oral temperature, I place the probe in the posterior sublingual pocket on either side of the frenulum, under the tongue. Your temperature is 98.4 degrees Fahrenheit. So the temperature is 98.4 degrees Fahrenheit oral route. Now I'm going to check your radial pulse on your wrist. I locate the radial pulse by using the pads of my index and middle fingers on the thumb side of the wrist, avoiding my own thumb. The pulse rate is 76 beats per minute with a regular rhythm and 2+ amplitude, which is normal. Now, without letting your patient know that you're counting their respirations, I leave my fingers on the radial site and observe the rise and fall of the chest. The respiratory rate is 16 breaths per minute with a normal depth and regular rhythm. Next, I'll obtain the manual blood pressure. First, I select the appropriate cuff size. The bladder should cover about 80% of the arm circumference and about 40% of the arm's width. I ensure that the manometer needle on the cuff is also at 0 before I begin. I position the patient's arm at heart level with the palm facing upward. I locate the brachial artery just above the antecubital fossa on the medial aspect of the arm. I apply the cuff snugly, not too tight or too loose. I want to make sure the center of the bladder cuff is over the brachial artery and the lower edge is about 2.5 centimeters above the antecubital crease. I place the diaphragm of the stethoscope lightly over the brachial artery. I want to place it firm enough to maintain contact, but not too firm that I occlude the sounds. I rapidly inflate the cuff to about 30 millimeters of mercury above the point where the radial pulse disappeared, or above the estimated systolic pressure. I then deflate the cuff gradually at the rate of 2 to 3 millimeters of mercury per second, listening for the Korsakoff sounds. I hear the first clear tapping sound at 118 millimeters of mercury, which is the systolic pressure, and the sound disappears at 76 millimeters of mercury, which is the diastolic pressure. All right, I'm going to remove the cuff now. Thank you. After completing the procedure, I perform hand hygiene again. And then finally, I will document the vital signs accurately, including the route and the patient's position. This concludes our demonstration of a complete vital signs checkoff. Be sure to follow your specific rubric and practice each step until you can perform it safely, accurately, and efficiently. Thank you for watching.